Hi, this is Dr. Steinke, and I'd like to talk to you a little bit about what to expect from a visit with us at Health Through Nature. For your first initial consultation, we like to spend time, like any other physician, getting to know you, trying to understand what your needs are. In naturopathic medicine, we really try to look for obstacles to cure. So our bodies naturally want to be healthy. They want to be whole and they want to heal. The question is, what are those obstacles that could be blocking or hindering your ability to do so? And that's why our visits take a little bit longer. We also use more subtle medicine, whether it be herbs or homeopathic remedies, and sometimes it takes some really characteristic type of symptoms that you display to be able to understand which one's the best for you. For example, if your body's cooling in nature and we don't want to overflow you with cooling herbs. So we're going to ask a lot more detailed questions than probably what you're used to with your standard medical visits. It's not that one is bad or good, it's just different because our medicine is more subtle. After we get a general understanding about your condition, your concerns, we always look to make sure that you're medically safe because we are licensed as physicians, and we'll make any recommendations for that or refer you out if it seems that that is the most appropriate thing to do. In our practice, we like to use something called applied kinesiology, which is a form of muscle testing that we can communicate through different energy points of acupuncture points, meridians, different skin sensory points that are called visceral points in osteopathic medicine. And we use your muscle as like a feedback mechanism, so your nervous system, to be able to help us get a little bit more understanding about where there could be imbalances in your body. This is just information for us that we like to use. Our brain is first and foremost trained well to be able to help assist you. Like I said, it's not that easy. I'm sorry that I can't be more clear about how this process works. But what we're essentially doing is we're gathering information to try to be able to help us understand what could be the best medicine, the least invasive and the least harmful that could potentially support you and put you back into a healing phase. Every naturopathic doctor has different tools. Our practice really likes using therapeutic foods, special diets, botanical medicine, homeopathy, different diet and lifestyle recommendations, certain exercises, or home hydrotherapy applications. Sometimes we'll use physical medicine if there's any pain to put bones and ligaments back into place. Sometimes we'll use Chinese medicine like acupuncture. And one of our favorite modalities is pranic healing, which is a non-touch healing modality. But what we decide also takes your input. So if you're like, oh, I'm not really interested in that, but I would like some of that, because your receptivity really matters when it comes to healing, and your engagement in the healing process also matters. So we like to get started with a various amount of those things that we've seen clinically relevant to be able to support you in that process. And then we may run labs. We may send you back to your dentist. Who knows what it is that you also need on your healing team. And then after a few weeks, we'll have you come back into the office and revisit what happened, what you were able to do, what worked, what didn't work, how you responded, and we'll create a new layer of healing. Our bodies are kind of like onions, the way that we like to use an analogy, and that we heal layer by layer. And we want to make sure that we heal at the appropriate layer so we don't overwhelm the body or the mind or even the finances, because all of those things could potentially have an effect of how fast you heal. We're always trying to look to accelerate the process as quickly as possible, but we're not trying to overwhelm, push, or overload the system at any point in time. So if this seems like it might be something interesting for you, but you'd like to know, well, how could this potentially apply to me? We have a How Can You Help session, and it's a 15-minute phone call where we can just answer a few of your direct questions, get to know you a little bit better, see if this might be a good fit for you. If not, we really wish you well on your healing journey. There's lots of different ways up the mountain, but we hope that you're well. Thank you.